I just remember like taking his patch off the next day, and he was like, I can see better than I've ever seen in like my life. And he, to this day, like, thank God, he's doing like really awesome. He's actually going to nursing school now.
Aw.
And that's probably my most memorable and like most gratifying patient that I have.
Good morning, everyone. Thank you for joining us this morning for Focus Through the Generations. It's Vision Care Connect, supported by Bruder Healthcare. It's our journey through 4 actively practicing ophthalmologists in the U.S. this year, just to get some opinions, some fun, some incitement about what goes on in the minds of 4 different generations of ophthalmologists. And we're so happy you joined us this morning. We have Dr. Alanna Nattis with us this morning. And Dr. Nattis, good morning, and thank you for joining us.
Good morning. Thank you so much for having me this morning. It's nice to see everyone.
we so appreciate you doing this with us. And just give you a few moments to tell a little bit about yourself, introduce yourself to the audience.
Sure. So my name's Alanna Nattis. I'm a cornea, cataract, and refractive surgeon in Long Island. I'm part of SiteMD, which is a large practice in New York. I'm also director of clinical research for our practice and associate professor of ophthalmology and surgery at my old medical school, NICOM in Long Island. And I'm very fortunate. So I'm part of a very large group, but I also get to practice with my dad and my husband.
Wow. Yeah. Oh, you are fortunate. So you're all in the same practice?
Yeah.
Oh, that's wonderful. Oh my gosh. Now, does that cause any family issues? I have to ask.
Not really, no. I think that, thank goodness we all get along, we all love each other, obviously. But it's nice to, bounce different clinical thoughts off each other. The only thing that, can happen is sometimes we talk about too much work at home. So, my mom and my brother might be like, okay, time to stop work talk.
They're done with you guys and your work.
Right.
That's really great though. Now, how did you all end up in the same practice?
So when I came out of fellowship, I joined practice with my dad. And at the time, my husband was finishing up residency. He actually did general surgery first, and then he switched over to ophthalmology. So he was just a few years behind training in ophthalmology because of that. And then it was just kind of a seamless transition for my husband Eric to join us in practice too. And it's really been great. It really has. I feel very, very lucky.
That's wonderful. I love that. We're hearing so many family stories. So we've interviewed a lot of father-sons and father-daughter. And so it's really fun. And I apologize because I didn't know your dad was in the practice. Maybe we'll interview your dad and your husband too. That'd be a good family unit. So we'd like to do that maybe. That's fun. Well, I just appreciate you being here and introducing yourself. I want to start off with kind of a fun question, if that's okay with you.
Sure.
You could have lunch with anyone, alive or dead or fictional. Who would it be and why?
That's a really good question. I feel like I have a lot of different answers for that. I think that I would love to have lunch with Queen Elizabeth.
Oh, yeah. Why? I'm interested now.
So I've always been very fascinated with the royal family. And I don't know, I think it goes back to, as weird as it sounds, this project that I did when I was in high school, where one of the things we had to do in one of our art classes was pick like a period of time and go over the fashion. And so I picked, England and, the fashion through the times. And I just was so amazed with just the beauty and the grace. And maybe I'm a little biased from having watched The Crown and just kind of getting like obsessed with that. But I just think she has so much poise through so much potential drama that can happen in this world. And I think to be able to kind of learn to have that poise in very stressful situations would be amazing. And just to kind of see how her life has shaped her, I think that would be interesting.
I don't disagree with that. I did watch an interview with her once, which I thought was really interesting. And she does hold her own anywhere. Doesn't matter where she is. She's very astute, but also she has emotions, but she doesn't let them get the best of her.
Right.
I enjoyed watching that. She's a very strong lady, someone to admire for sure.
Yes. And also a dog lover, which I am too. So I think you hear
You have
that.
dogs.
Yeah, so we have a long-haired dachshund named Lily. She is just like the love of our life. And we have become like a dachshund family. My brother has a dachshund as well, and we all just are obsessed with them. So
They are pretty, pretty dogs. My cousin had one growing up. They're really pretty.
Mhm.
Um, well, what brought you to ophthalmology? Was that your father being an ophthalmologist? Was it something, how early in your life did you know that's the path you wanted to take?
Um, I really would say it was probably mostly my dad. I mean, I used to go with him to the office when I was like 4 or 5 years old, and not really know what was going on, but I just always remember it being very positive. And he always just felt very happy in his career. I think that he was really a wonderful mentor because of that. And it was very gratifying. And as I got older and I kind of understood all the surgeries that he did and everything, I really just thought it was amazing. And when I entered medical school, I knew that I always liked ophthalmology. I did, keep my mind open, and I really did enjoy doing surgery, but I really liked the microsurgery the best. And of course, ophthalmology is by definition microsurgery. So it just kind of fit what I wanted. And I would just also love that there's a lot of continuing innovation in the field. I think that I just feel like I'm constantly learning and I can constantly bring new stuff to our patients, which is just awesome. But he was probably the biggest push from the beginning.
That's nice though. And it's so great you practice with him. Well, you spoke of technology. So one of the questions that we've asked everyone is what technology in your practice right now could you not do without?
Um, I think that as a cornea specialist, I don't think I could do without my topographer. I mean, we use a Pentacam in our office for topography, and I think that it is just so valuable. Especially, we do a lot of cross-linking, and to catch these younger patients that are just developing keratoconus, and to potentially save them from having to have a cornea transplant down the line, or save them from having scarring in the cornea, and to stop the progression of keratoconus. I think that for me right now is our most important part of our diagnostic equipment tools.
Makes sense. Makes a lot of sense. Um, what do you think now that you're in your practice with your with your family, but it's a very large practice as well? Where do you see yourself in 5 to 10 years? Do you see yourself in that practice? Do you see yourself with?
um, I do. I still see myself in our practice. We're continuing to grow, which definitely makes it interesting. It's we're just growing a lot as a company and spreading out a lot as a company. So I think it'll be interesting to see how that will affect, if we stay in the same locations or if we, go to different areas more often. But I do see, I think that we've been fortunate to really start, running, with our practice. We've been really building our practice and we're really busy. My husband's really busy too. My dad, I don't think is planning on retiring anytime soon. He's also really busy. So I think we're still going to keep moving forward. So, we always joke that, maybe we'll move down south one day because our family loves Florida too. My in-laws are down in Florida also. But right now I think we see our whole family just being in New York still.
That's good. Well, during this past year, some of the things I know we've had to all adapt our practices to different processes and different means of seeing our patients. Out of all the things that you have had to do to survive and continue to see your patients in 2020, what out of those things would you take forward with you now that, let's say, post-COVID, if we ever get to post-COVID, but what is something that you learned during that period that you will continue to do?
Um, So, we actually, our location was one of a few locations that remained open throughout COVID. We did close a decent amount of our offices, but we remained open for emergencies. And I think that one thing I became a little bit more attuned to was triaging patients correctly, and really like listening to I mean, we always listen to patients' concerns, and in our practice, we always say, like, if there's an emergency, even if it's maybe not so much an emergency, just come in, we'll see you, we'll take care of it. With COVID and with patients being so afraid to come in, when we were at the height of the pandemic and New York was on lockdown and everything, I think that being able to reassure our patients, and our office has done really such a good job of social distancing and making sure everything is clean to the point of almost being sterilized when patients come into the room in the office. Just being able to continually reassure our patients that we're there for them, obviously as their physicians, as their surgeons, but also as their overall to protect their health. And when they go home to their families, they don't have to worry they're, God forbid, bringing something home with them. We have, and so I think that's going to continue on, just to kind of always keep our patients reassured that we really have their overall best interest as whole, for them.
And what about telehealth? What role did that play in your practice?
It did play a major role for the first, I would say, month and a half into our lockdown, which was weird because in ophthalmology, I feel like you can't diagnose a lot. In telehealth, maybe like chalasia, that's pretty easy. But I think that, we actually do offer to some patients who, perhaps they have a lot of medical comorbidities. They still don't feel comfortable coming into the office now. And so I think we'll always still do it, but to a much lesser extent because we are more comfortable being open now and seeing our patients. And, I've accommodated patients and told them, if I start at 8, okay, you can come in at 7:30 in the morning. You'll be the only one there. And then you won't be near anyone. But I think, telemedicine, it is definitely a helpful thing for patients that are just a little bit nervous about coming in.
Yeah, I think so too. It has its place, but not for everything, right?
Yeah.
I want to ask you, what is your most memorable patient? It could be a funny situation, a sweet situation, just something that stands out in your mind as one of your most memorable patient moments.
I think my most memorable patient was actually the first cornea transplant I did in private practice. So it was probably like a month in to starting work. And I was referred this patient who was, I think he was 21 at the time. And he has keratoconus in both eyes and with scarring, unfortunately, in both eyes. So no cross-linking could be done. And was also amblyopic in one eye. And so he needed a corneal transplant. He actually needed a corneal transplant in both eyes, but he wanted to do the transplant in the eye that did not have amblyopia. So a lot of pressure. Basically, like a monocular patient. He's young. I was like, oh my God, it's my first transplant. And I just remember like taking his patch off the next day, and he was like, I can see better than I've ever seen in like my life. And he, to this day, like, thank God, he's doing like really awesome. He's actually going to nursing school now. And that's probably my most memorable and like most gratifying patient that I have.
And were you about to pass out when you took the patch off?
A little bit. Like my hand was shaking like a little.
And when did you tell him it was your first it was your first corneal transplant?
I didn't tell him. I mean, I was yeah. I was fortunate. I did a lot of transplants in my training. So, it was just that. And my dad also does, assist me in the OR with my transplant. So, it was good to have him beside me for that surgery. But, for the first one coming out, that was a good one.
Well, I'm happy it turned out well for you. And it was a good moment that you can carry with you. That's wonderful. I love that. Have you personally had any eye surgeries?
I have not. I have not had any eye surgeries. I'm very myopic. I wear contacts and glasses. My eyes are quite dry. So that's one of the reasons why I have not had refractive surgery. But, and that's one of the things, we do a lot of LASIK and PRK in our practice too. And I think that I'm able to kind of relate to, or maybe like 25-30% of patients who may not be great candidates for refractive surgery and say, look, it's me too. Not everyone is a great candidate. It can be awesome, can be a great surgery, but not everyone is a good candidate.
I love the fact that you said that, because I think that's so important for patients to hear that not everyone is a great candidate. It's a great procedure. It works well. And if you can have it and it's done well, you're going to enjoy it for the rest of your life. But if you have it and you shouldn't have,
Right.
you're not going to enjoy it or enjoy your eyesight for the rest of your life. So I appreciate you saying that. I think you have a good testimony there with patients. That's very nice. Well, we have always ended this, but before I end, I want to ask one question. What do you do outside? Now that your whole family's involved in ophthalmology, what do you do outside of that for fun?
So my husband and I actually really love playing tennis. So we do play a lot of tennis. I'm still very involved in doing art and kind of like little decorative things. So when I have time, I try to do that as well. And we my parents have boats, so during the warmer weather, like we'll go out as a family, like on the boat, which is very nice. But I try, with a lot of the stuff that we do, unfortunately, that we do have a lot of work on the side that we do, with research and stuff like that, which I love. But I think just trying to spend time outside, doing, either playing tennis, just hanging out, trying to reincorporate our friends after the pandemic,
Fun.
just to be together, enjoy each other's company.
That's nice. Well, I'm going to end with our last question. We ask this of everyone. How have you seen technology in ophthalmology transition since your career started? And where do you see technology going in the future, say the next 15 years?
I mean, since my career started, it's just been on this exponential rise, I feel like. And with like almost every way possible. I think that one of the big things with cataract surgery now is, and also other surgeries too, is we're moving more towards intracameral therapies versus topical. So, you look at Durista for the treatment of glaucoma, the iDose insert, which they just released for the phase 2 data for treating glaucoma. That's, I think, going to be like a very big deal. Even Dextenza for treating postoperative inflammation for cataract surgery. So all trying to improve patient compliance, right? And also improve patient outcomes because they're less dependent on using drops postoperatively or to treat their chronic condition. I think that's going to continue for sure. I think that's a big trend. There's also been a lot with artificial intelligence and diagnostics and better quality diagnostics and being able to diagnose conditions earlier. So I think those are all going to play a big role in also determining earlier treatment paradigms for our patients. So I think it's hard to predict what's going to come next, but I think that I'm continuously like surprised in what comes next. So that's why I love ophthalmology so much, because I feel like I'm constantly learning. It's constantly like new information and new interesting stuff. And I feel very privileged that we can offer it to our patients too.
That's a great answer. And it is. Technology is moving so fast. It's almost catching up with the computer world, where you buy a new computer and it's outdated in a month. So
Right.
that's kind of where we are now. Well, Dr. Nattis, thank you so much for being with us this morning. I appreciate you giving us the time, and we so look forward to getting this together and airing it for you.
Yeah, thank you so much for having me. It's been a pleasure meeting you and talking with you. So thank you.
You too. You have a great day.